Dear student, in continuing of our previous discussion, again we are here with few more definition in the topic of infectious disease. What is subclinical case, what is case, and what is carrier? Here, the subclinical case, a person in which the disease agent multiply in the absence of any clinical sign and symptom. For example, single case of wild polio having 1000 subclinical cases in children and 75 subclinical cases in adults. So these are the potential source of infection in the community for the spread of that particular infectious disease. Second is, what is the case? It is a person in the population or study group identified as having particular disease, health disorder or condition under investigation. For example, a case of measles. It is 100% clinical case. We don't see any subclinical case or carrier in case of measles. Same way in rabies, the scenario is same. Third important definition is carrier. What is carrier? An infected person or animal that harbors a specific infectious agent in absence of discernible clinical disease and serve as a potential source of infection to others. We all are aware about the classic carrier in case of typhoid Mary. Typhoid Mary was responsible for several epidemics during her lifetime on account of she used to carry the typhoid bacilli. Whenever she worked as a cook, she used to transmit that particular infection to, or we can say during her lifetime, she transmitted typhoid to 1000 plus typhoid cases. More new more definitions like primary case, like secondary case, and index case. First, we need to learn about the index case. What is index case? It's the first case to come to the attention of the investigator. It is not always a primary case because once the disease is being spread in the community and it may be under the notice of investigator late, during which already few secondary case must have developed. What is primary case? The first case of communicable disease introduced into the population unit being studied. What is the secondary case? The case which are developed from contact with the primary case. Here, let us discuss these definitions with the example. There is a household in which four children are there. All of them are unvaccinated. So all are at risk of getting measles. There is one primary case on 1st of January. Later, after 7 days, two more case two more cases are seen in this particular household only. So these two are considered as a secondary cases. So this one is the primary case. These two cases are the secondary case. Okay, and the case which comes under the attention of investigator is considered as a index. Maybe first case, it may be second case, it may be third case. What is the definition of incubation period, median incubation period, and latent period? The incubation period is the time interval between the invasion by an infectious agent and appearance of the first sign or symptom of the disease in question. For example, in case of measles, the incubation period is 10 days. The entry of the organism might have before 10 days when we see a frank case of measles with sign and symptom. Why the concept is important? The concept is important because the shorter incubation period gives the idea regarding the lethality or the we can say the how the disease is potentially transmitted or dangerous. Time required for 50% of the cases to occur following exposure is termed as a median incubation. And the third definition is period from disease initiation to detection. This concept is important in communicable disease as well as in non-communicable disease like hypertension and diabetes mellitus. Disease initiation might be there for last few months or few years, but the disease detection can be on later as we don't see any sign and symptom in earlier part of the pathogenesis of this disease. Few more concept like serial interval. What is serial interval? Serial interval is the time gap between the onset of primary case and secondary case. So if the serial interval is shorter one, then we can say the disease is more infectious, more communicable. Generation time is the interval of time between the receipt of infection by a host and maximal infectivity of the host. So mere presence of the organism inside the host doesn't suggest that person is infectivity or we can say he is maximally infectious. So this generation time denotes the interval of time between the receipt of infection, the maximal infectivity of the host. Third important definition is communicable period. It is the time during which an infectious agent transferred directly or indirectly from an infected person to another person, from an infected animal to man, or from infected person to animal, including arthropod. So, for example, in COVID-19, the communicable period is 2 days prior to appearance of first sign or symptom to first week, or we can say 8 days after the appearance of the sign and symptom. So, by knowing the particular disease communicable period, we can have an idea regarding the infectiousness of a person. For example, in COVID-19, once the patient will be there in our OPD with sign and symptom, that person might have already spread the condition to other as it is communicable, it is infectious during the incubation period itself. The more important concept, what do we understand by the attack rate, secondary attack rate, and R naught or R0? Attack rate is nothing but the proportion of incidence cases, that means new cases, that experience the outcome under study over a given period of time. For example, the period of epidemic. Here, hypothetically, we think that there is one epidemic in a village and there are 25 new cases and the population at risk was 100. So, the attack rate would be 25 divided by 100 into 100 is equal to 25%. What do we understand by the secondary attack? Is the number of exposed person developing the disease within the range of incubation period following exposure to the primary case. It is the number of exposed person developing the disease within the range of incubation period following exposure to the primary case. So to carry forward our previous example of measles, here you would see there were initially four susceptible children. First primary case happened, then within incubation period, two more cases were seen. So here the secondary attack rate would be 2 as the two secondary cases divided by 3 as we should exclude the primary case from the at risk population into 100, which could be 66%. We need to remember that we have to exclude the primary case from the numerator as well as from denominator. So again, our discussion of that particular slide. One more new concept that we come across is R naught, R0, or we can speak this terminology as a R naught. So what is R naught? Is the average number of secondary infections produced by a case of infection in fully susceptible population with no immunity. So in case of COVID-19, the R naught is 2.5. So one person can be able to infect 2 to 3% in the susceptible population. What is the importance of R naught? To compare various infectious disease. So this is the R naught of COVID-19. What is the R naught of measles? Is 18. So single case of measles can uh, infect about 18 children in near future. Okay, so this is about the R naught. So I guess this is all about today's discussion. Will be available shortly with one more video during in relation to this topic only. Thank you. Thank you very much.